All right, Randy Alvarez here, host of the Wellness Hour. We're doing our, in 18 years, Dr. Liebowitz, Howard Liebowitz, a medical doctor, had him on the show. I think I met him 15 years ago. And he has, would you call it an integrated medicine clinic, functional medicine
I would say
clinic?
alternative, integrative.
Anti-aging?
Anti-aging.
Now, I met him 18
medicine.
years ago, and you can't see him standing up, but he's physically fit. And I told him, and I even told his front desk, he hasn't aged in the last 17, 18 years. So he's obviously walking his talk. We're here to do some ozone therapy, which I know very little bit about. And I told him in advance I was going to go out of my way not to research this so we could have a conversation about it and let people know. But here in Santa Monica area, people from all over LA, all over Santa Monica are coming in for these treatments. It is the celebrity people that are in the know. The celebrities come here to look and feel their best. We can't mention their names, but you know who they are. So, Howard, so what are we doing? So you're hooking me up here?
A lot of what we do with ozone, there's a number of different things that ozone is very beneficial for. We use it as an anti-aging treatment because when we're doing what's called high-dose ozone, which has only been done for about the last year and a half, and this was introduced to us by a doctor from Austria, a guy named Lahadny. We used to only do one bottle treatments, and the whole treatment would be over in 10 minutes. This guy Lahadny started experimenting with higher and higher doses of ozone, and he actually he went over 10 bottles, but he found that the sweet spot for maximum benefit of ozone therapy is at 10 bottles. So now we have what is called Lahadny's high-dose ozone treatment, which is a 10-bottle treatment, and you'll see how we do the bottles. We're going to do blood exchange. And the benefits to this, when you start to get up into that higher doses, is you actually start to mobilize your stem cells. And you can literally mobilize stem cells from the bone marrow that then circulate through your blood, and you'll get a benefit for weeks and weeks.
I mean, are you killing off some of the bad bugs?
Well,
that's
what this. You're getting a little ahead of me because that's something else that we do. The preventative and anti-aging effect isn't really killing off bugs and things like that. It's basically mobilizing your immune system and mobilizing your stem cells. And so this is for well people who want to stay well and they want to stay healthy because your bodies are constantly being bombarded with viruses and bacteria and even cancer cells. So our immune system does what we call surveillance. The immune system is always checking your body, killing things off, protecting you. And when something happens where your immune system gets stressed or you get stressed and your immune system gets suppressed, then a virus gets to take hold or a bacteria gets to take hold or a cancer cell gets to take hold, and you start the process down the road of a disease. So one of the benefits of doing this is to activate and mobilize your immune system to keep you more robustly healthy and prevent you from getting down one of those roads.
And some people come in here and get this like once a week.
Well, the people who get this once a week are people who are really treating for an illness.
Okay.
The people who are coming in for prevention, what I call prevention or anti-aging, they'll do this maybe 2 or 3 times a year.
Okay.
And it's enough to keep their immune system robust. I also have people who will come in and do this, like for instance, if they're getting on a long airplane flight, and you know how you're exposed to all those germs in an airplane. I have people who will come here for a treatment before they get on an airplane, so they don't get sick, and then they come here after they come home from the flight so that they don't get sick, because it jacks up your immune system and helps you fight things off. So it's very, very preventative.
Do people, I mean, am I going to feel it today? Like I already feel pretty good.
Yeah.
Am I going to feel something today?
Well, the types of things well people feel from this is they often feel energized, their brain feels more clear, because one of the things that happens when we mix the gas with your blood is your body gets saturated with oxygen. So, and oxygen is a very healing, anti-inflammatory type of medicinal anyway. So a lot of people feel very energized after a treatment. And I have people who will come in for a treatment, they'll get 3 bottles, 5 bottles, whatever, and then they go work out at the gym because they can work out harder.
Interesting. Okay.
And they clear out lactate easier and things like that. I've treated professional athletes, I've treated boxers, I've treated cyclists, I've treated weightlifters, and they'll do these treatments to actually help them train harder and lift heavier weight.
Now, what I like that you told me in your reception area, because you were in the ER, right, for many years at Cedars-Sinai, and you said I said, what's this ozone thing? I mean, why do you like it so much? And I'm paraphrasing slightly, but you said, because you've never seen anything get people better like this.
Yeah, I've never seen a medicinal treatment, and this is not medicinal, but I've never even seen a medicinal treatment work this fast. So the beauty with ozone is
cancer. You have people that have had stage 4 cancer.
Yeah.
That give this credit for helping them reverse it.
My most famous case that I personally have had, and I'm in a chat group with doctors who are doing ozone all around the world. I mean, you have to realize ozone is not something new. Okay. Ozone's been around for over 100 years. We used to use ozone before penicillin was discovered. And it was the only way that was used to treat bacterial infections. So if you got sick in 1900 and you got in the hospital with pneumonia, you would have gotten ozone.
Why did they stop it?
They didn't have any antibiotics. Well, antibiotics got discovered, and everybody said, gee, you know, we could take a pill. Why do with ozone treatment? And it fell out of favor. It just wasn't considered stylish. It wasn't considered modern. But in a few countries, Russia, Austria, Germany, they never gave it up. And they've always done it. And now what we're seeing, you may have heard about superbugs, where these bacteria are getting resistant to every antibiotic, but nothing is resistant to ozone. So ozone kills bugs, kills germs, kills viruses, kills bacteria, and kills cancer cells, and simultaneously upregulates your immune system. So you have like a double whammy effect.
So autoimmune diseases, things like that.
Autoimmune diseases respond to this very, very well. Inflammatory conditions in general. I mean, one of the things that I experienced personally is I came in, I was coming down with a virus or a flu. And I came in, I asked my nurse to start an IV on me, give me a treatment. And then she left because she had other things she had to do. So I had to run the machine myself. And at the end of my treatment, I had to reach up here and turn this valve off. I had been suffering from biceps tendonitis from lifting weights. I had really sore shoulder for 6 weeks. Couldn't get rid of it. I reach up here to turn the valve off, and the pain's gone. While I'm sitting on the bed, the pain disappeared and never came back. That's how anti-inflammatory is. So when you talk about things happening fast, it's incredible. I treat people with shingles. Have you ever had shingles?
No, I've known people with shingles.
It's nasty. It's nasty. It's a herpes.
And it shortens the time of it.
1 day.
Is that right?
1 day, I knock out shingles.
It seems like that they would have a press conference about this.
Well, shingles breaks
shingles
out.
Is big business for the drug companies.
Drug companies don't like this stuff. They don't like this stuff because it makes them look bad, and it can replace a lot of medication. You know, when you get a shingles outbreak, you're going to go to the doctor. He's going to give you prednisone, which is an anti-inflammatory, which suppresses your immune system, and he's going to give you something like Zovirax, an antivirus medication. And it's not going to get rid of the shingles. It's going to slow down the course of the shingles, but you're going to get a rash, a nasty rash. It breaks out. It often follows the ribs and things like this. And it lasts for weeks. And then after the rash is gone, a lot of people get what's called post-herpetic neuralgia, which is terrible pain, just because the nerve
you've seen people
was damaged.
But you've seen people, you've given ozone to.
So I had this lady came in. I do a lot of hormone work, as you know. This woman comes in and we're sitting and we're talking about her hormones. And then she says to me, oh, Dr. Liebowitz, by the way, I have a rash. Could you take a look at it for me? And I take a look at her chest over here, and I could tell immediately she's breaking out with shingles. She didn't know what it was, but I caught it early, and I said to her, you know, you're lucky. Come on in here. Let me give you an ozone treatment. I give her an ozone treatment. I call her back the next day. Gone. Gone in 1 day. This is normally a condition that could last 6, 8 weeks. Gone in 1 day. So I have always been amazed by this. My most famous case that I was going to tell you about is the woman with cancer. She's probably 52 or 53 years old. She went to the doctor. She wasn't feeling well. She's in menopause. She was never on hormones. They diagnosed her with metastatic stage 4, which is the worst type, metastatic breast cancer. It's in the ribs, is in the pelvis, is in her liver. The doctor was going to offer her chemo. He said to her, maybe you'll live another 2 or 3 months.
Wow.
But, you know, the chance of the chemo working is probably less than 10%. Her daughter was in the pharmaceutical business, and she decided she didn't want to go the pharmaceutical route. So she researched, found me, brought her in here, and we started giving her ozone. I was giving her 4 bottles, just 4 bottles, because gets more expensive the more bottles we have to do. So she was doing 4 bottles, but twice a week, very, very religiously. She went back to the oncologist at 16 weeks. It was like a month after the doctor thought she wasn't going to live. And they repeated her PET scan, which is a head-to-toe body scan to see if there's any cancer cells anyplace. And the radiologist calls the doctor and he goes, "You sent me the wrong patient," because he put up her first scan, which showed the cancer, and he put up the follow-up scan after she had 16 weeks of ozone, and he thought it was a different patient because there was no cancer on the follow-up scan.
That is interesting.
And that's amazing. I mean, I didn't
That is
expect that.
amazing.
I didn't expect that. I actually could never have said that that was going to
Now,
happen.
in your chats with ozone people across the country, right? Are you hearing similar stories like
Yeah,
this?
I hear stories like this. I mean, I'm in a group of doctors literally all over the world. There's doctors I communicate in Spain, doctors in Cuba, Austria, Germany.
It can't hurt to do it in combination with their therapy, with
No.
their chemo or whatever.
No.
See, you know,
And it does work. It does work
I've been
well.
interviewing medical doctors for the last 18 years, and one of the things they tell me off camera is that when you get cancer, I mean, you're thinking about saying goodbye to your relatives, you're distraught, and you feel like that, and everybody's coming around giving you advice, but you also, they have told me that you feel like that if you don't do this treatment, you're going to die, you're dead. So it's tough to, there's only a small percentage, maybe the Whole Foods crowd, and even those people that would look for these so-called alternative therapies.
I agree. But, you know,
So it's
when,
just getting the word out.
when you're giving a choice of a chemo that may work maybe 10%, that's a pretty low success rate. A lot of those people will opt for something alternative. And this woman was very,
How
very
can you
lucky.
reach out to these cancer patients?
It's difficult because I can't say that ozone cures cancer.
Right.
I can't make a statement like that. Even though I have one really great anecdotal case, you know, you need studies, you need double blind, you need all that stuff. I can't make a statement like that. So you have to be very careful with it.
But you have seen miracles here in this practice.
I have.
People that felt lousy and now they feel great.
And I treat
People
Lyme disease
What about
patients.
brain fog, things like that?
It helps that stuff. It helps dysplasia. It helps fibromyalgia. It helps all sorts of autoimmune diseases. A lot of chronic viruses. It helps Epstein-Barr, chronic fatigue. A lot of those types of viruses. And my Lyme patients, I have a number of Lyme patients who do very, very well with this. I have HIV patients who are doing well with this. I have HIV patients who won't take any chemotherapeutic medications.
And I like this.
And they're actually maintaining and being very stable doing ozone, and then they do herbs and vitamins and supplements and a healthy diet and detoxification, and their disease is not progressing. So there's a lot of benefits, healthy benefits without side effects. The beauty of ozone compared to a lot of pharmaceuticals is all pharmaceuticals, you know, have a negative. They have a downside, they have a side effect. And ozone is side effect free. It's got a lot of upside potential.
So the main thing is it's a big boost to the immune system.
That's the big way that it
And
works.
some of it, you guys don't even know the mechanism of why it works so well?
There are some components of when we treat different diseases, why it works, we're not even really that sure.